once we are sure that patient has polycythemia vera, then the next question is that polycythemia vera patient in front of you one that he or she has a high risk of thrombosis or a low risk of thrombosis? We know that polycythemia vera patients have increased risk of blood clotting or thrombosis in general, but we can divide them in two groups. And this is based on two factors. One factor is age over 60, and the other factor is history of blood clotting already. If you have one or the other, that particular patient is at a high risk of thrombosis. In our particular case, the patient is newly diagnosed with polycythemia vera, never had a blood clot, and it's younger than 60. Therefore, low risk for thrombosis. Patients that are low risk for thrombosis with polycythemia vera are treated in a simple way. They are given aspirin, and that would be baby aspirin, 81 milligram, to make blood flow easier, to make it simple. And the other one is phlebotomy. Phlebotomy is the bloodletting with the aim to decrease the hematocrit. This is the goal, to decrease the hematocrit below 45%. In the history of polycythemia vera, we always correlated the experimental information from dogs or other animal models. How would increased risk of thrombosis correlate with the increased numbers of red blood cells that circulate around the blood, which is polycythemia vera? Now, a few years ago, there was finally a prospective randomized study done in Europe that was randomizing patients with polycythemia vera with an aim to, in one group, maintain the hematocrit, a measure of the blood, below 45%, or not to be so strict and allow hematocrit to be between the 45% and 50%. And this prospective randomized study was stopped early after about 3 years of follow-up because it was quite clear that the group that had tight control of hematocrit below 45% had fewer thromboembolic events, fewer clotting episodes. And this led to fewer deaths from the complications of having those clots. The main reason for polycythemia vera to die, the main cause of death, is thromboembolic event. So if we follow what this prospective randomized study by Dr. Marcioli and colleagues showed, is that tight control of hematocrit below 45% leads to fewer thromboembolic events, eventually decreases the risk of dying. That's the ultimate goal. So we should be all following tight control of 45% hematocrit as the goal of therapy.